I am Dr. Karen Gordon-Boyle, Deputy Chief Medical Officer, and thank you for joining me for today's COVID-19 update. Now for the global statistics. According to the World Health Organization, the total number of cases is 10,357,662, with 508,055 deaths. Regionally, the number of cases is 5,218,590, with 249,318 deaths. I will now bring you the update for the situation in Guyana. As of July 2nd, 2020, of the 34 tests done, our total number of positive cases has climbed to 250. 117 persons have recovered, but we recorded another COVID-19 death, bringing the total number to 13. In institutional isolation, we currently have 120 active cases, 16 persons in institutional quarantine, and 2 persons in the COVID ICU. To date, we have tested 2,668 persons, with 2,418 being negative. Fellow Guyanese, yesterday I made a special appeal to our residents in Regions 1 and 7, where over the past 2 to 3 weeks, the number of positive cases has been climbing rapidly. I am pleading with you to stop and spare a thought not only for your safety, but for that of your family, neighbors, and residents in the communities. You need to cooperate fully with the Compliance Division of the Ministry of Natural Resources, the Civil Defense Commission, the Army, and the police, who will be working collaboratively with the Ministry of Public Health to contain the spread of this fatal disease in your communities. Some of you still believe that COVID-19 is a gimmick, that you cannot contract this disease, and that if you are infected, you can easily recover and move on with your life. That may be so, but remember the trauma that your body undergoes when COVID-19 strikes. You do recall from yesterday Natalie's account of excruciating pain, the unbearable pressure in her chest, as if a concrete slab were there, her delirium. Why put yourself through all this, not knowing of your body's shape in the aftermath of COVID, when avoiding all this simply entails adhering to the guidelines? I hope that the potential trauma of COVID-19 resonates with you and causes you to change your behavior patterns. In this same vein, I also wish to address our repatriating nationals, the terms of whose return includes an agreement to home quarantine for 7 days. Why, on your arrival in Guyana, do you then choose to disregard this and to saunter out into the public, knowing that you can potentially be putting at risk the lives of those you love the most? Just a reminder, provide accurate information at the points of entry. Remain at home for the agreed period so that the health officials can call and check with you. We continue to say thank you to all of our health workers who continue to screen the population, provide testing for suspected cases, and treat the positive cases. We also want to extend heartfelt thanks to our international partners, PAHO, UNICEF, UNHCR, IOM, the Chinese Embassy, as well as our local organizations, NGOs, Qualfund, the Lions Club, Singers, the Private Sector Commission, and many others for their overwhelming support and donations, which have contributed tremendously to our fight in mitigating the spread of this disease. We look forward to your continued collaborative support as we battle COVID-19 in an effort to bring our country and our lives back to normalcy. Fellow Guyanese, do your part. Respect the curfew, wear a mask, practice physical distancing, and only venture out if necessary. Stay safe. Thank you.